Here's a quick tip for yoga enthusiasts or yoga instructors trying to help their clients feel and function better during fun activity. Now, when you do various yoga movements, some of the more complex or dynamic movements require one leg to be back and one leg to be forward. So for example, in some of our warrior poses where one leg is back and one leg is forward, the pelvis needs to rotate in opposite directions. For those of you who don't know, there are actually two sides to the pelvis, and when you take one leg back and one leg forward, they actually rotate in opposite directions. So if I was to take my left leg back, my left side of my pelvis would rotate down at the front, up at the back, whereas with my right leg forward, the pelvis is going to rotate up at the front, down at the back. So they're rotating in opposite directions. Obviously, if I was to do the opposite on the other side, so with my right leg back and left leg forward, the opposite's going to happen. My right side's going to go down the front, up at the back, and my left side is going to go up at the front, down at the back. Now, that's all well and good doing those yoga movements equally on both sides if our pelvis is balanced and in alignment. However, for many of us, our pelvis isn't balanced and in alignment. So if we go and then do these yoga movements equally on both sides, we can actually make an underlying imbalance worse. So before you perform yoga or do yoga, you want to make sure that your pelvis is in alignment so that when you do those movements, you're going to actually make your body feel and function better rather than worse. So here's a quick assessment you can do. So Ashley's lying on the ground and she's just going to do a pelvic tilt. So when she tilts her pelvis to flatten her lower back, she is posteriorly rotating her pelvis, which means the front of her pelvis is going up towards her rib cage, and the back of her pelvis is going down away from the back of her rib cage. Now what we're going to do in a minute is coach her to let go of that pelvic tilt, and when she lets go of it, her lower back's going to arch and her pelvis is going to anteriorly rotate, which means that it's going to go down at the front, up at the back. And I'm going to ask Ashley what she feels so that we can make assessments about whether her pelvis is in alignment or not. Let go of the pelvic tilt. And when you've let go, is one side of your butt more in contact with the ground than the other? Yes. Which side? The left side. So her left side is more in contact with the ground than the right side. So what that tells us is her left side of her pelvis falls into an anterior rotation more than the right side. Because here's her pelvis. She was in a pelvic tilt, so she was posteriorly rotated. When we let go, or when we coached her to let go of her pelvis, left side of her pelvis continued to rotate forward. And if this was her butt right here, it means that when she let go, more of her butt came in contact with the ground. So rather than doing a very complex assessment where we actually look at her pelvic bones and try to figure out are they in alignment or not, we can ask Ashley by her kinesthetic feedback or feel which side is actually anteriorly rotated in relation to the other, which means which side is more rotated forward. And that she told us that was her left side. So we need to correct that with this exercise. And what we're going to do is I'm actually going to coach Ashley to put her right leg down, and she's going to put this left leg up on a chair. Now, what this is doing is anteriorly rotating her right side because she's putting this leg down, which means that her pelvis on her right-hand side is going to rotate down at the front, up at the back. So we're going to anteriorly rotate this side. This leg, the left side, is now forward, which means her pelvis is going to posteriorly rotate because as she swings this leg forward, that pelvis needs to rotate under. So she's doing the opposite of where she is naturally or normally. Remember on Ashley, her propensity is for her left side to anteriorly rotate, which is to go down at the front, up at the back, and her right side to posteriorly rotate. We want to do the opposite. So we're putting her right leg down, which will anteriorly rotate her right side, and put her left leg up on a chair, which will posteriorly rotate the left side. That will put her pelvis into better alignment or be neutral before she begins yoga. So she's going to stay in this position anywhere from 2 to 5 minutes, and you feel that your lower back is arched on the right-hand side, and you feel that your lower back is actually flatter on the left-hand side. Do you feel that? So let's imagine that she stayed in that position for up to 5 minutes, and then what we can do is come out of that, and she can check her pelvis again. So bend both knees, do our pelvic tilt. Good. And as we let go, just see if there is any difference. Let go. And does that feel more even? Do you feel more contact on both sides of the butt?
Yes.
Wonderful. So that's an easy assessment she can do to check her pelvis and make sure it is in alignment before she begins yoga, so that she will feel and function better during this fun and popular activity.